So when it comes to the allergy part of things, if you say, hey, listen, every season, when grass season comes, my eyes itch, my throat gets a little tight, and I'm sneezing all the time. Well, I might have you take grass homeopathic. There are homeopathic remedies that you can spray under your tongue. They will immediately neutralize you. You might have to do it a half a dozen times a day for 3 or 4 weeks to get you out of the acute phase. But then we're also going to look at, well, can we solve this? Can this be solved so next season it doesn't happen? Well, that's where getting your liver and gut working better plays an important role. And also a therapy that was developed in the 1960s in Britain called low-dose allergy therapy. And this is taking almost homeopathic doses of the substances that you're reactive to and injecting them under the skin, subcutaneous. But actually, when you go down the steroid pathway and bronchial, like using medications to dilate your bronchial tubes, you get on this kind of chronic drug pathway that actually depresses your immune system, disrupts your gut microbiome, and makes you more prone to the next kind of reaction that takes place. I mean, these medications are not innocuous. They have to be metabolized, particularly by your gut and your liver and your kidney. And when you get exposed to these substances on a repetitive basis, you get a failure to detoxify, where your liver goes, yeah, you have to go beyond the traditional medical thing. So, listen, I'm a family doctor. We run blood tests like Chem25. There's liver tests called AST and ALT. Most of the doctors and patients are familiar with these. So, you may have chronic asthma, chronic eczema, and, you do blood tests and you do skin scratch tests and everything looks completely normal. So you assume that your liver's normal. But the problem is, the liver is involved with phase 1, phase 2, phase 3 detoxification. Unless you're testing phase 1, phase 2, and phase 3 for functional medicine tests, you've missed it, which means that in the conventional medical system, you're then put into a category, like I mentioned earlier, of having psychosomatic illness. This becomes a mental health problem. That you need antidepressants, anti-anxiety drugs. You learn to live with it. It's stress in your life, and everybody kind of buys into that nonsense that goes on day in and day out in medical practices. The reality is that you have to look at what's going on with my liver.
Cures, Remedies, and Beyond podcast with Dr. Irina, a Stanford-trained medical doctor, inventor, and a published author with over 30 years of clinical experience, is bringing together the science of medicine and the art of healing for ultimate vitality and health. It engages in discussions with healthcare providers, wellness experts, innovators, philosophers, spiritual and industry leaders, as well as health and wisdom seekers to provide you, the listeners, with practical tips and knowledge to help optimize your health and well-being. The Cures, Remedies, and Beyond podcast with Dr. Irina.
Welcome to the show. Today, our topic is allergies. Allergies is the 4th most common disease in the world now, and it keeps growing, according to the World Health Organization statistics. There is a broad range of allergic diseases: atopic dermatitis, afflicting skin, like eczema, respiratory allergies, like hay fever and asthma, and food allergies, with symptoms ranging from mild to life-threatening reactions. Today, I'm very happy to introduce our very special guest today, Dr. Martin Gallagher. Thank you for joining us, Martin.
Thank you, Dr. Irina. It's great to be with you today.
You have the most unique background. You're not only a medical doctor specializing in integrative and family medicine, you're also a licensed acupuncture physician and a chiropractic doctor with many decades of clinical experience. I believe this allows you to look at the health and the body in the most holistic, the most unique way. And in your clinic, you have been incorporating a big range of healing modalities, unique laboratory testing, IV nutritional therapy, lasers, ozone, stem cell therapy, and many others. You're a true innovator. You have been helping people not only to treat their acute and chronic illnesses, but also have been helping them staying well, which is quite unique in this day and age when medicine is typically addressing only the emergency cases in the most skillful way, but the wholesome health and the practice of medicine has been somewhat lacking. And so, as an expert in the field, Martin, I wanted to ask you, what do you think is the development of allergic diseases really linked to, and why is it rising?
Great question and an important consideration. In the past, we always thought of allergies as being driven by your immune system. So in classic medicine, it's called an IgE reaction. In other words, you're exposed, for instance, to mold or to grass, and your body hasn't seen that before, or genetically you're predisposed to it. And if you look at the blood, you'll say, well, I produced IgE, which is a substance that helps you to counteract the substance that you're exposed to and technically neutralize it. But if the substance that you're exposed to, say that happens to be wheat or grass or trees or mold, if that is sufficient, large enough, strong enough, and your immune system not capable of handling it, you might have a life-threatening problem, like your throat may close. And we read about these all the time. People have a bee sting and they die. They have an allergic reaction, their throat closes. But we've come to understand, particularly over the past 20 years, that there's another mechanism in place, because these IgE reactions, these immediate reactions that drive people to their family doctor because of asthma and eczema, various kinds of atopic dermatitis, really doesn't explain the whole story. We're really dealing with a very large milieu of people that are hypersensitive, reacting to chemicals, food, environment, substances that are in the water, drugs, clothes that they wear, environmental pollution. And so the IgE thing just doesn't explain it. This is what happens. You see your family doctor and go, I have new rugs in my house, and for some reason, I'm getting sick. My skin is itchy. I get headaches and migraine. Or you go down the basement and you get exposed to mold and you start to get lightheaded and dizzy and confused. Or I've had patients, for instance, they buy a new car, become ill because of the chemicals that are coming off or off-gassing off of the automobile. IgE does not explain this. And so family doctors in turn go, I can't find the IgE reaction taking place. You get sent to an allergist. They scratch your skin looking for skin reactions and do the IgE blood test. And if you pass those tests, you're put into a category of having psychosomatic illness, that it's some types of like mental illness, or it's in your head, or we don't know why. And it's because we have narrowed this whole thing down into this IgE throat closing kind of reaction, when in reality, there's a wide variety of things that people react to. There's a test called IgG4, for instance, for food allergies. You can test 2 different foods, and these foods may react to you. In fact, most people that have allergies, they're a delayed reaction. You might, for instance, eat eggs and 3 or 4 days later have a migraine headache, but you never connected the two. I've had that happen with patients. Eat peanuts or peanut butter, get an asthmatic attack 3 or 4 days later. These are delayed reactions to the substances because we have this immediate immune system, this IgE, and then we have the backup system, the IgG. And that doesn't take go ahead.
So just to explain a little bit, that IgE is immunoglobulin E that is responsible, of course, for the activation of specific immune cells called basophils, and then they obviously release little granules with histamine. So, and that's what you were talking about, of course, that that is a classical understanding of what the immune reaction is. But now we're actually dealing with much more unique dysfunction of several interdependent biological systems, sounds like. So that cannot be only explained by this classical immunoglobulin E. So there is immunoglobulin G, as you said, so that has a delayed reaction. So
Yes, and that's a test that your family doctor and allergist are not going to perform. So that if they scratch your skin and they find that you react to mold and dust, you get mold and dust shots over a period of 3 or 4 years. They're not highly effective, but that's kind of the classic treatment. And then when you have an acute reaction, you get steroids, inhalers to dilate your bronchial tubes, and emergency room visits. But actually, when you go down the steroid pathway and bronchial, like using medications to dilate your bronchial tubes, you get on this kind of chronic drug pathway that actually depresses your immune system, disrupts your gut microbiome, and makes you more prone to the next kind of reaction that takes place. I mean, these medications are not innocuous. They have to be metabolized, particularly by your gut and your liver and your kidney. And when you get exposed to these substances on a repetitive basis, you get a failure to detoxify, where your liver goes, I can't do it anymore. So what does it do? It shifts these foreign proteins into your bloodstream. They end up in your skin. Your skin is not a true organ of detoxification, and it's sort of an organ of elimination, but not detoxification. Your liver is supposed to be detoxing you. Your kidney is supposed to be detoxing you. Now you're asking an organ that otherwise shouldn't be doing this to do the job of your liver. And that's why these foreign proteins end up in your skin as chronic eczema. I've had people just weeping skin. Skin problems come from the inside out. Plain and simple. It's an inside out problem. If they end up in your bronchial tube, you're going to get a tight bronchial tube, right? And so that's part of the asthma and chronic COPD reactions that take place.
So you're saying that basically modern medical approach with the inhalers, steroids, and others, especially steroids, because it is a chronic issue, asthma. So as we know, steroids have immunosuppressive action. Almost 30% of the immune system gets suppressed temporarily, even after the steroid injection. So for a few weeks, up to 2 weeks, I understand. So, and you're saying that that's not the answer. So the answer is to look deeper into the potential liver detoxification problem. And that is the link that you think that exists between allergy and the not really fully functional liver?
Yeah, you have to go beyond the traditional medical thing. So, listen, I'm a family doctor. We run blood tests like Chem25. There's liver tests called AST and ALT. Most of the doctors and patients are familiar with these. So, you may have chronic asthma, chronic eczema, and, you do blood tests and you do skin scratch tests and everything looks completely normal. So you assume that your liver's normal. But the problem is the liver is involved with phase 1, phase 2, phase 3 detoxification. Unless you're testing phase 1, phase 2, and phase 3 through functional medicine tests, you've missed it, which means that in the conventional medical system, you're then put into a category, like I mentioned earlier, of having psychosomatic illness. This becomes a mental health problem. That you need antidepressants, anti-anxiety drugs. You learn to live with it. It's stress in your life, and everybody kind of buys into that nonsense that goes on day in and day out in medical practices. The reality is that you have to look at what's going on with my liver. It's like if you have a screen on your window, well, that keeps the bugs out, keeps the no-see-ums out and the mosquitoes and everything else. But what about if you punch the little tiny holes in those? What are you going to get inside your house? That's sort of like what happens to your liver. It's not diseased. So the medical tests look perfectly normal. You do a CT scan of your liver and kidney, it's going to be normal. But at the same time, you may have abdominal pain, irritable bowel syndrome, Crohn's disease, chronic eczema, asthma problems, because your liver and your gut have the failure to detoxify, which are oftentimes linked to what we call the ABCs: antibiotics, birth control pills, C is cortisone or steroids, and S is sugar, refined carbohydrates in the diet that feed these type of problems that lead to funguses, viruses, and bacteria from the ABCs.
Interesting. And you also have mentioned the gut. So, and I'm wondering if you think there is a role of the gut health and the gut microbiome in allergy. So we obviously now know that in our human body, there are 30 trillion human cells, but our microbiome is an estimated 39 trillion microbial cells that consist of 1,000 of different species. So, and you actually think that there is a link?
Absolutely. First of all, we have 100 trillion cells. All humans have 100 trillion cells. In those 100 trillion cells, we have two brains. So if we take a look at evolution from an evolutionary standpoint, our gut evolved first, and then gradually our brain. So it's kind of interesting what takes place. If we take a look at the current research, we know, first of all, that the gut produces all of the neurotransmitters. So when you talk about, you say to someone, well, you don't have enough serotonin, that's why you're depressed. You don't have enough melatonin, that's why you can't sleep. And you go, well, where's that produced? And people go, there. Well, no, the majority of it's produced in your gut. Every neurotransmitter is produced in your gut. So if your gut's not healthy, your brain can't be healthy. And remember, there's a tight barrier in your gut. There's a tight barrier in your brain. There's a reason for those barriers or boundaries. It's called the blood-brain barrier. There is a gut barrier. Those are tight junctions, and those tight junctions are supposed to be tight for a reason. You let the good guys in and you keep the bad boys out in your brain and in your gut. However, if you are taking aspirin on a routine basis, you take antibiotics because you have a supposed sinus infection, you give your kid an antibiotic for a supposed ear infection, which, by the way, doesn't exist. And now you've blown up your gut microbiome. You've made those tight junctions loose. Now your border wall is a problem. People start streaming from South America into California. It's a problem. You've opened your border. Now what do you have? You got the bad boys living in your bloodstream, and they got to go swimming someplace. So they go through your bloodstream, they can end up in your joints. That's called osteoarthritis, rheumatoid arthritis. They
And
end
you're
up in
talking about a leaky gut syndrome,
leaky gut.
correct?
Yeah.
That's the newer
Yeah, leaky
understanding.
gut. It's a
How
leaky gut, right? These tight junctions no longer are tight. The drugs, particularly, like a lot of people are taking acid blocking drugs. You know, they take Prevacid, these kind of medications. These medications are commonly prescribed by doctors. They're supposed to be for ulcers for 4 to 6 weeks, but the drug companies have pushed them into everybody taking them if your stomach's upset about anything. It's like overeating, then take these drugs. That causes erosion of your gut lining. You take an aspirin. Aspirin is contraindicated, by the way, even by the American Academy of Family Practice. Most doctors don't recommend, that are on the cutting edge of this, don't recommend aspirin. Almost no one needs aspirin. But you're taking an aspirin because you think that's prevention and you're getting gut erosion. You're also increasing your risk of renal disease. So renal failure is linked to taking non-steroidal anti-inflammatory drugs. Aspirin is an NSAID, and also increasing your risk of heart attack. So you're disrupting your gut. So here's a classic example. You have a patient that comes into your office. She's 45 years old, otherwise healthy. She gets an upper respiratory infection, which by the way is not an infection. You go to your family doctor. They give you antibiotics. You take steroids. You take an inhaler. 6 weeks later, you've got problems with your abdomen bloats easily. You frequently have bouts of diarrhea. You have foul smelling gas. And you know what? My memory just isn't the same. I can't think clearly. It's like I have brain fog. Like there's a coating around my brain. Now go tell a family doctor or an internal medicine doctor that, right? You know what you're getting, right? You're getting shipped off to the psych. You're getting shipped off to a psychologist. You might end up getting a CT of your abdomen or an upper GI series or a CT scan of your head, all of which for the most part is going to be negative. But it's due to the antibiotics that you took for a supposed sinus infection. Sinus infections don't really exist. Ear infections in your kids don't exist. The term infection is an inaccurate term. These are viral imbalances, bacterial imbalances, secondary almost always to eating dairy products, eating high sugar diets. Dairy and wheat products are highly linked to these kind of problems. And antibiotics are contraindicated for sinus, bronchitis, but they're called infections, which is why
and
kids have been bombarded left and right.
Right. We're definitely overprescribing, as you said, the non-steroidal anti-inflammatory medications with clear, of course, side effects to liver, kidney, and the GI bleeding from those aspirin and non-steroidal anti-inflammatory medications as Aleve, ibuprofen, naproxen, so is one of the leading causes of emergency room visits and even death
Yes,
and
of course.
hospitalizations.
Yep.
So that's quite interesting. So,
And I've
and
seen
you're
a number of these cases, Dr. Arena, in which I've had people that of all different ages that are relatively healthy, that have a kidney infection or a skin infection or a dental problem, and they take antibiotics, maybe steroids too. And in turn, the link between colitis and those problems. But also from that point forward, they become allergic. I've seen it time and again. Oh, well, I eat these foods now and they make me sick. They make me nauseated. I get digestive upset. I blow up like a balloon. I fluctuate between constipation and diarrhea. But they never really make the link between the antibiotic that they took and the onset of these problems, which can occur up to 6 months later. You've disrupted your colonies in your gut, which have been genetically modified over billions of years, not millions, billions of years. So this gut microbiome, which are the things that you live with that are directly connected between your gut and brain, is now disrupted. So we know that the connection between your gut and your brain is via the vagus nerve. The vagus nerve is bidirectional, and that nerve runs from your brain to your gut and your gut to your brain. And it's also interlinked to the limbic system. So what happens then? You start to get things like emotional stress, like anxiety, a little panicky. You don't feel clear. You can't sleep at night. Your thought process is disturbed. Mention that to a family doctor. See where you're going to.
right,
You're going to
right.
Psych 1. You know what I mean?
Yeah.
And that drives you into the whole drug cartel thing that's going on, which is categorize you, drug you, charge you, leave you basically in pharmaceutical prison.
So yeah, we definitely know how to treat the symptoms, but yeah, so people like you, who are of course specialists in integrative functional medicine, understand the causes, and as you mentioned. Vagus nerve, so which is obviously is the biggest, largest nerve in our body that is responsible for the parasympathetic nervous system that is responsible for rest, digest, right? So and um, peaceful, so to speak, emotional status rather than opposite the sympathetic nervous system, right? So which is obviously necessary for short periods of time, so to save us from the a tiger run away, right? So and the adrenal discharge that helps us to save our lives. But when we're on a chronic overcharge of sympathetic nervous system, that's when we start, of course, having all this adrenal fatigue, and we have all the anxieties, as you mentioned, and some psychological issues that obviously regular doctors never even connect with such a simple thing as potentially gut health. So I want to ask you, let's say if a patient has certain allergic issues, comes to your clinic. So let's say, there is either asthma or some kind of, um, seasonal hay fever that is, twice a year, so really puts people in a miserable state. So, what's your course of action? So, how do you test? How do you really approach them in terms of diagnosis, treatment, and maintenance?
I approach them several ways. First of all, we take a look at a more extensive history. So a history in our office takes about an hour and a half. So it's really looking at your whole lifestyle, right? It's looking at your family history. It's looking at what you eat, how you supplement your diet, what stresses, medications you've taken, what operations you've had. It's looking at that whole deal, like actually talking about it, right? Not punching things into a computer over the next hour and a half, actually asking you questions and you providing information. That should lead any physician into a course of action like I have a little bit of a handle about what's going on here in the direction I need to go. By getting that kind of history, our examination is a functional medicine evaluation. So it's not just like blood pressure, pulse, that whole scene. I mean, that's all nice. It's important to do. But we also do things like applied kinesiology, pulse evaluation, looking at the tongue, right? Chinese diagnosis. We take a look at functional medicine tests. What's a functional medicine test? Well, listen, if you tell me, I fluctuate between constipation and diarrhea, I've got IBS-C or IBS-D or IBS mixed, well, then I want to take a look at your digestive system. So how am I going to do that? Well, functionally, we'll evaluate your stool and we'll find out, do you have enough gut bacteria? Do you have parasites? Are you producing enough hydrochloric acid, pancreatic enzymes to digest your food? Do you have any inflammatory markers that are suggestive of other kinds of problems? Is there an increased cancer risk? That's the kind of stuff that we want to look at. Functional medicine tests of your liver, called phase 1, phase 2. Delayed food allergy test. That can be done through blood tests. Urine tests that tell about organic acids, which tells you about what's going on with your brain, your liver, your kidney at the cell level. You really need to take a look at the cell level, cell metabolism, and your mitochondria where your energy is being produced. Looking at that data gives you a good print about what's taking place. But I get that information. Quite frankly, I treat patients. I don't treat tests. I look at tests. I look at the data. I look at the patient. So to me, if someone says, listen, my hair's thinning, it's drying easily, I'm tired as the day goes on, I have low libido, my skin's dry, I gain weight easily, I'm mentally dull, you know what? You're hypothyroid until proven otherwise. And even if your blood test is normal, I'm going to treat you with Armour thyroid. So when it comes to the allergy part of things, if you say, hey, listen, every season, when grass season comes, my eyes itch, my throat gets a little tight, and I'm sneezing all the time. Well, I might have you take grass homeopathic. They're homeopathic remedies that you can spray under your tongue. They will immediately neutralize you. You might have to do it a half a dozen times a day for 3 or 4 weeks to get you out of the acute phase. But then we're also going to look at, well, can we solve this? Can this be solved so next season it doesn't happen? Well, that's where getting your liver and gut working better plays an important role. And also a therapy that was developed in the 19th in Britain called low-dose allergy therapy. And this is taking almost homeopathic doses of the substances that you're reactive to and injecting them under the skin, subcutaneous. Usually,
it's like a little vaccination almost principle, right? But using such a small diluted doses, which is what we call homeopathic approach.
That's exactly right. It activates your T cells. There's a T cell memory that takes place. And I can tell you that, some of the things I'm talking about, I'm in this field because I've experienced many of these things and in turn solved many of them through chiropractic, through acupuncture, through prolotherapy, through IV nutrition. I've sort of been like in God's laboratory. I feel like, I'm Geppetto and Pinocchio. So the reality is that you can take the homeopathics to neutralize you during the symptom complex, but then you want to solve it. And LDA, once your body gets a memory of it, when you come around the next season, you're either going to react to it very mildly or you're not going to react to it at all. And it's not something you have to do the rest of your life. You take these little tiny injections every 2 months. For food, it usually takes 2 or 3 treatments. For environmental substances like dust, grass, trees, that may take 6 or 8 treatments. If you're chemically sensitive, that takes a little bit longer, where you're reactive to chemicals in the environment. That usually takes about 2 years, but it makes a huge difference. And in the meantime, if you're working on cleaning up your gut, getting your liver working better, getting your kidney working better, you're supplementing your diet, like supporting it with adrenal, quercetin to help you with bronchodilation, pantothenic acid and vitamin C. Remember, what do they make in your body? Steroids. Steroids are made from fat, vitamin C, and pantothenic acid, a B vitamin. So We prescribe those often to patients, and I've done that for decades with patients with a whole wide variety of things. I've had patients that come in with welts. They're like golf balls and softballs in their body where they can barely move their body because of gigantic histamine reactions that take place. But, you can downregulate those kinds of disturbances over time. But it does require work on the patient's part too. Like I say to the patients, listen, I'm going to help you. I have an understanding of what's going on. These are the steps that you need to take, and I'll help to guide you. But, you've got to do your part. If you don't do your part, you're in the wrong office, because the office you need to be in the drug office and get yourself drugged. You know what I mean?
Yeah, that's very fair, I'd have to say. So lifestyle modification. So, but let me just go a little bit back and understand. So basically what you are mentioning with the homeopathic, either sublingual or tiny injectable subcutaneous remedies. So the whole goal is desensitization, correct? So because
That's
when
correct.
when our body is bombarded by all these chemicals or pollen or other, of course, triggers, so our immune system starts attacking it and reacting it, and it basically is trying to help us, but by helping us, it's basically creating this exaggerated reaction, so that we actually call allergy, right? So, and through this particular remedies, you're basically trying to guide that, gently guiding immune system to desensitize and to basically not to attack it with such a rigor, correct?
Yeah, I mean, if we take a look even at autoimmune diseases, you look at Crohn's disease, ulcerative colitis, some forms of multiple sclerosis. These autoimmune diseases, what really are they? They're an exaggerated reaction by your immune system, right? So, if you're putting toxins in your body and you have an unhealthy gut, say you have small intestinal bacterial overgrowth, you have SIBO, which is quite common in today's world because of GMO foods, because of taking COVID shots, which are biological weapons that disrupt the gut. You take these things that constantly disrupt your gut becomes unstable. And when it does, lots of stuff can happen. A lot of different kind of reactions take place. So you want to start the process of neutralizing and getting your gut healthy. Drink aloe vera juice. Take mega probiotic on a daily basis. Eat foods that are low in carbohydrate, whether it's vegan or meat eating. It doesn't really matter. If you take a look at all these different kind of diets, they all work. They all eliminate refined carbohydrates. So the rate limiting factor is getting rid of refined carbohydrates. So getting rid of sugars and flours out of your diet is really a critical thing to get your gut healthy. And some people, they need just straight protein diets. Some people, they can tolerate plants. Some people with gut problems, they can't digest lettuces. They can't have any greens. There's a wide variety of things. If you're on the front lines working with patients, you realize how educational some of the books are in the health field and how ridiculous they are too, because there's so much biodiversity. You have to look at the fingerprint of each person and work with them on that basis for them to get healthy. And once they start to realize, it's their body and God that heals their body, that you've got to tune into that and start listening to those messages. Intuition or a gut feeling is God speaking to you. That's spirit to human. We're a dense manifestation of spirit, right? So, and we return to that, so that same field. So this dense part requires refinement. And when your body is speaking to you and it's giving you symptoms of headache or back pain or numbness or weakness or anxiety or depression, you need to listen to it and say, what is it that you're saying to me? And how can I start to solve this naturally, safely, effectively, so that I don't take one problem, make it 10 problems? Medicine is about taking one problem, covering it up and creating 10 more, and then treating the 10. That feeds directly into the cartel mentality that's going on worldwide. And we talked about vaccines. COVID is not a vaccine. They changed the definition of that. That was the drug companies and the federal government that changed that on the behalf of drug companies. We all know that a vaccine means that you take a toxin, you put it under the skin, For instance, like before flu season, little injections under the skin in September. So by the time you hit December, your brain goes, oh, I know what that virus is. I've seen that before. I've seen those particles before. But on the other hand, when you take things like COVID shots, those aren't vaccines. Those are biological weapons. Those are dangerous substances you're putting in your body. That is not desensitizing you to anything, which is why there's been the multitude of complications that have taken place.
So, but going to back to the allergies. So you actually think that allergies are reversible, correct?
Oh, completely reversible. Yeah, I have patients come in with asthma, and I asked them, I said, do you want to get to the stage of decreasing medication and eliminating the problem and becoming asthma free? For the people that say yes, I say, well, it's probably going to be a 6 to 24 month process, but it's doable. Because if you're removing the triggers, you've solved the problem, right? So we know from some of the chiropractic literature and acupuncture literature that the sympathetic nervous system and the parasympathetic nervous system control the bronchial tube and lung, right? So if the middle part of your back is out of alignment, or there's a problem with your acupuncture system of your small intestine and lung, that disturbance in turn can cause your bronchial tube to tighten. So the drug companies, what do? They give you an anti-inflammatory drug like steroids, or they give you a bronchodilator that temporarily dilates your bronchial tube, dilates the muscle so you can breathe more, right? Well, the same thing occurs when you adjust the spine. You go to a chiropractor or you have acupuncture or both. We prefer using both so that you can get acute decrease of asthma, or in some people's case, resolution of asthma, depending upon age and length of problem, through using that method, right? So for people that are chronic, it goes like, okay, it helps, but it doesn't solve it. Well, then you have to desensitize maybe to mold, dust, grass, trees. You need to clean up your diet. I mean, I've seen tons of people go into asthma problems from eating dairy products. That's a huge one. Milk, cheese, ice cream, yogurt are gigantic triggers. If you have sinus problems, recurring bronchial problems, your kids have these ear problems, which they're called infections. They're not infections. Get them off of dairy products. Dairy products, it's not a food. It's not a food group. You need to be breastfed. And after being breastfed, that's it. You don't need anything from the dairy family.
That's so interesting. So also you mentioned, of course, spirituality, which is beautiful, actually, additional layer of the wholesomeness, if you will, right? So, and wholeness in terms of the treating your body as this God's vessel, if you will. So, and how does it really work, like meditation, yoga, prayer, so in terms of the down regulating allergic reactions?
Well, basically, if you think about what people do to try to make themselves feel better, it's like they do things that temporarily make them feel transiently better, but long-term make themselves sicker. For instance, if you're anxiety, you drink alcohol or taking anti-anxiety drugs. So what's the side effect of that? Side effect of that is depression. You take antidepressants, you temporarily feel better, it leads to anxiety. This kind of very vicious cycle that takes place, right? But what you're trying to do is you're trying to change your consciousness. It's like these thoughts are driving me crazy. I can't tolerate it anymore, right? So you have to transcend thought. So you have to do forms of meditation, whether it's transcendental meditation, Buddhist meditation, Christian meditation. They're all labels for the same thing. Basically, you have to tune into your breath or use a mantra, a word, which in turn then signals your nervous system to activate your software program, which basically begins the process of activation of more and more your parasympathetic nervous system, so that you go from the gross to the sublime. You go from the gross to the atomic and then to the subatomic. So when you meditate, you actually, in the meditative process, and this has been demonstrated through EEG studies, you transcend thought. So if you said to someone, listen, how would you feel if you weren't thinking thoughts? They go like, oh, I'd love to stop thinking thoughts. That'd be wonderful. How do I do that? I said, well, you need to learn to meditate. And they go like, Well, I can't because my thoughts, I keep getting bombarded by thoughts. I can't stop thinking. But, your brain, its job is to think, right? Your heart's job is to beat. So you allow your brain to think thoughts. That's what the frontal cortex is for. Your limbic system is going to have emotion attached to that. And so you need to meditate on a daily basis, just like exercising, to remind you of who you are. Who are you? Are you Dr. Arena? Am I Dr. Gallagher? Yes, but no. I am transiently in this experience that we're having, but ultimately, no. No. I'm part of the whole, I'm part of universal intelligence. Temporarily in this vessel, doing what I do for my purpose, like you do for your purpose. And if you're not in that purpose, there's dis-ease, right? There's dis-ease.
Yeah. And that's where the true healing actually starts, in that practically spiritual quantum world that we're still trying to decode. So with the modern science and medicine. So
that's a good way of describing it, decoding it. That's exactly right. And it's up to each one of us to assist that decoding process. Right?
Yeah. So we're going to take a very short break, and we will be right back with our wonderful Dr. Martin Gallagher. So now we're back. Martin, that was a really enlightening conversation. I have to say, I didn't even expect from the simple subject, seemingly as allergy, to get into the beautiful discussion about the health and spiritual healing, as well as, of course, such unique types of approaches to your allergy treatment. So I have one last question, actually.
Yes.
Once you and I talked, and you have mentioned that when people are going through the changes in their life, like menopause or andropause, and you notice that a lot of people start to develop actually predispositions practically to allergic reactions.
Yes.
What are your thoughts on that, and how do you deal with this situation?
Yeah. So when you go through change of life, by the way, all men and all women go through change of life. I hate to break the news to men, but it is menopause, right? There should be woman pause and menopause. Everyone goes through that change of life. Okay.
Or you don't call it andropause, you call it menopause.
Right. There's woman pause and man pause.
That's very clever.
That might not be politically correct, right? With like 16 different kinds of variations, but the reality is that that's what happens. But interestingly enough, based on the research of Morgenthaler, who originally studied testosterone in rats and then later in humans, it was found out that, these hormones are brain hormones, right? So they took young rats. I know, there's some people that go, there shouldn't be rats research, but there is. And the rats were sexually active. They're young rats, right? And they reproduce and everything, and they get erections, et cetera, right? So they remove their testes and they become like old rats. They lose their interest in things. They don't want to eat. They just kind of lay around. They gain weight, all this kind of stuff that happens with people when they go through change of life. But interesting, what Morgenthaler did is he took the testes of these young rats and then implanted them in their brains. Guess what happened? They became young rats again. What did that tell us? The receptors for your hormones are in your brain. Sure, they're in your breast, they're in your clitoris, they're in your penis. We think of these as all reproductive hormones. I mean, they are reproductive, right? But they're predominantly brain hormones. So what do women say to me when they start to go through change of life? I mean, other than hot flashes, waking up at 3:00 in the morning and feeling revved up, being tired and wired the following day, decreased libido or loss of libido. They go like, I used to have a very clear memory and I can't remember things. I have brain fog now. I just can't seem to remember. Am I developing dementia? A lot of people say that to me. In addition to things like, I started as a grape and now I'm a raisin, because you start to literally just dry up in your body. So the smart
The
person,
skin, the wrinkles you're talking
yeah,
about.
yes,
Yeah, some of us can relate. Yeah.
everything drops and droops, right? What you have to do is you have to replace the hormones. So you want to do it as bioidentically as possible. That's why they're called bioidentical hormones, replacement therapy. So when we have patients that have these kind of problems, whether they're men or women, then we check their 24-hour urinary hormone levels and in turn begin replacing what's missing. So people would say, well, that's not natural. If you're going to go through change of life, then you should just go through change of life. And I go, well, let me ask you this. In 19, what was the average age that a female died? 52. That's when the reproductive life ended. Men, by the way, on average died at age 48. So now if we go, okay, a woman's not going to live to 52. She may live to she's going to double her lifespan. Ditto for the male. Well, do you want to feel 40 or 50 years bad, or do you want to go, well, I've got my libido back. My strength has come back. My muscle mass has come back. I can get erections. I have libido. I feel like a grape instead of a prune. I can think clearly. You have to put back in the hormones that are missing. That is a strategy, a critical strategy. Now, medicine has demonized this because remember, for years they gave Premarin, which is pregnant. These were the 20 horse hormones that were given to women. And they also gave them Provera, which was synthetic progesterone. So if you take a look at the Women's Health Initiative from about 20 years ago, that big study that said that estrogen causes cancer, actually, when you look at the study and the arms of the study, you find out that is not true. Even though they gave synthetic estrogen, which we don't recommend, the estrogen group had less breast cancer than women that took nothing. The trigger for it was Provera, synthetic progesterone. So what do we recommend for teenagers that have bad menstrual cycles? Natural progesterone. What do we recommend for women that can't sleep at night? They wake up at 3 a.m. with hot flashes or feel racing thoughts. Progesterone, not just melatonin. Progesterone is really critical for that at much higher doses, by mouth, by pellets we put under the skin, or by oral capsules that you take, or creams. You can do it any way. Estrogen, well, there's 3 types, has to be put back into your system by creams, by pellets, by oral consumption. DHEA is the primary anti-aging hormone produced by the adrenal. It's the largest circulating hormone in the brain. You have to have it. It starts diminishing at age 30, 35. And men lose testosterone and DHEA. So if you don't put that back in, then you've got like an irritated guy that's gaining weight, that mopes around, doesn't want to do anything, and has poor erection response. So if you want to feel old, then don't put the hormones in. Now, keep in mind that family doctors and gynecologists discourage people from doing this. So I encourage people to read Bunting's research on this, Dr. Bunting, who wrote a book called Estrogen Matters, primary researcher in estrogen. Very important to read. And also read Morgenthaler for men at Harvard Urology. Good stuff. Because years ago, doctors would tell people you can't take testosterone. Testosterone causes testicular and prostate cancer. Complete nonsense. Utter nonsense. It protects you from cancer. If estrogen were the cause of breast cancer, my God, wouldn't every girl 13 to age 30 have massive breast cancer? Their big estrogen production years? They have decreased amount. Who gets the breast cancer? Most people as they age. Who gets prostate cancer? Men as they age, right? So you have to have, and I'm not saying everybody needs a big dose of a hormone. We look at those, look at the symptom complex, and in turn treat accordingly. What's the goal? The goal for a female, by the way, is the obliteration of all the signs and symptoms of menopause without breast sensitivity and without a period, right? That's the goal.
just to definitely what you mentioned, there is such a huge link with cardiovascular diseases in men and women due to decline in estrogen. So not to mention, of course, the dementia and obviously the
and women
sexual
need
function.
testosterone. So keep that in mind. So, if you're
Right.
doing bioidentical hormones, most women need a small dose. I say women need a couple raindrops of testosterone and men need a lake, right? So that analogy is important to remember. A woman might need 1/4 milligram of testosterone or maybe 5 or 7 milligrams max, where a man may need 100 or 200 milligrams.
Right, because we women, of course, have naturally certain amounts of testosterone, so much less, of course, than men do, and that obviously helps with the muscle mass, helps with libido, as you mentioned. So yeah,
And bone density.
well,
Bone density is a huge
and
thing.
bone
So
density.
show me someone
Yeah,
that has osteoporosis, and I'll show you someone that I'm going to recommend that they take testosterone, not to
yeah,
grow a beard, to make them stronger. And the bone
yeah.
density starts improving after about a year and a half.
That's really interesting to know. So, yeah, as you mentioned, it's such a good point that we're not trying to revert to the youthful 19-year-old level of hormones in our bodies, but we're just trying to extend our mental capacity and our health since the lifespan increased. Pretty soon, we're probably going to have 20 years lifespan, so might as well increase our functionality and well-being.
Well, that's a good point. It's the functionality. If someone said to me, "You want to be," I would say, "Absolutely not. I don't. I don't want to be 80." But if today and tomorrow I feel really good, I'm spot on. I'm ready to roll. If you take a look, for instance, they've done studies on people that have really healthy lifestyles and people that have poor lifestyles, and they live almost as long. It's in that last 5 to 10 years where the person with the healthy lifestyle, they feel good and then they die. The other group of people with the bad lifestyles, they live to about the same age, but that last 5 or 10 years, they're sick
And miserable, of course.
and
And that's
miserable
not the
and in and
best
out of
way to go.
doctor's offices and, all the medications. The average American is taking 7 prescription drugs.
Yeah. Yeah. Wow, that was a wonderful conversation, Dr. Martin. So, where can our listeners find you if they would like to
They can find me
explore
on the
some?
pickleball court. I play a lot of pickleball.
And then I understand you're like a state champion in your age category, and that, so which is impressive.
Yeah, so if I lived to that, I might get the gold medal. They can go on the AAOM website. We're both in that group, the American Academy of Orthopedic Medicine, AAOMED.org. And we're an organization that teaches worldwide. We teach physicians regenerative medicine, of which you're doing a fantastic, fantastic job of that. So anyone that comes into your sphere is blessed. So, yeah. And I was thinking about just within our group, we have people that do injections for PTSD that can reverse a PTSD problem. Or for a lot of people, they suffer because of pain. But giving regenerative injections, you start the process of reversing it.
Yeah, as well as the unique stellar ganglion block. So yes, we're planning to bring those doctors to talk to us more about all these unique treatments. So
Yes.
thank you so much. So we also, of course, will list your contact information on the episode page. So it was a pleasure. And thank you for joining us.
Keep up the great work. Thank you.
Thank you. Yeah, thank you for joining us at Cures, Remedies, and Beyond, exploring science and the wisdom of health and healing. We hope to see you next time. Thank you very much, Dr. Martin.
Thank you, Dr. Arena. Excellent.